Welcome to Connecticut eHealth Podcast, educating, conversing, and connecting for better health. The Connecticut eHealth Podcast is a space where we get together with local and national experts, key stakeholders, and other individuals in the space of eHealth to discuss health information in Connecticut and around the country. This podcast is brought to you from the UConn Health Interoperability, Innovation, and Learning Lab, where our mission is to promote the optimal adoption and use of eHealth by providing education and engaging in conversation with leaders to create connections for better health. So let's sit back and get connected. Hello, this is Tom Agresta. I'm a family physician and clinical informaticist at the University of Connecticut, and I'll be your host for this episode of Connecticut eHealth Podcast. Today's guest is Lisa Stump, Senior Vice President and Chief Information Officer at Yale New Haven Health System and Yale School of Medicine, as well as a Connie board member. Connie is our state's health information exchange. Lisa graduated from the University of Connecticut School of Pharmacy and the Ohio State University College of Pharmacy with a master's degree in pharmacy administration. She's an active lecturer, commenter, and speaker on healthcare IT and digital health. She's an adjunct professor and a member of the Board of Visitors of the College of Health Professionals at Sacred Heart University. And I've known Lisa for a number of years in our first attempt at getting Health Information Exchange to go in Connecticut. So welcome, Lisa. We're glad to have you on the show.
Happy to be here. Thank you, Tom.
So tell us a little bit more about yourself and how your interest in Health Information Exchange sort of developed and your role in that as both a CIO and a consumer of healthcare yourself.
Yeah, thank you. I think when I began my career as a pharmacist, I often say I think I grew up just at the right time when all of the communication in the hospital where I worked was still in the form of handwritten notes in a paper medical record, handwritten medication orders that as a pharmacist, I struggled to read and interpret with the weight of the patient's safety, sort of resting on my ability to interpret what the physician had written and appropriately transcribe it onto yet another piece of paper that another human would try to then read to get the right medication to the patient at the right time. And it set me on a path, even as a pharmacist, ultimately a manager and director of pharmacy, to leverage technology to make the work that we did safer, less reliant on human memory and human diligence, more efficient, more cost effective. And so throughout my career, I found myself always at the center of recommending technology innovation or implementation, often then leading it. And that, carried me into the seat I'm in today as the Chief Information Officer. And, I think for many of us, we've all seen probably that really unfortunate avoidable event where a very well-intended and often expertly trained care team in trying to care for a patient ultimately does something that results in harm to the patient because the right information wasn't available, whether it was the patient's allergy information or their medication list. And for me, it's what drives my passion in ensuring that the right people have the right information at the right time to make the right decision for the patients that we're privileged to serve. And so that has led me to participate for a number of years, as you mentioned, in our statewide effort to implement a health information exchange and make it functional and usable for the good of our communities.
So that's a wonderful kind of story as to what brought you where you're at, and it sounds like that it might have been even my handwriting that you had to struggle with at some point.
Could very well have been, yeah.
And I as a clinician who had to write on those paper forms and hoped and prayed that they were interpreted correctly, I do know that digitization of some parts of our medical system have really helped, and yet we're still struggling and moving along. So as you kind of think about, the value that a health information exchange can provide above just sort of the digitization digitization, I should say, of like handwritten notes and handwritten prescriptions. What do you think of the HIE? How does it provide value to the larger healthcare system?
Yeah, so I'd probably start by saying, I always frame HIE as both a noun and a verb, right? There is the active verb, the action of exchanging and sharing information, and then there's the entity, the noun that is the HIE. And I think there's incredible potential value in both. Um, the story I shared earlier about, the care team not having the right information in the moment, I think is an example of the verb. We need to get and push information into the right hands. And then, beyond that specific problem, more generally, what are all of those right types of information that can be of benefit, not just to the care team, but to our public health officials, to the patients themselves as their own advocates, to our personal support and care teams who can also, again, advocate for us as individuals. But I think all of that clearly with people and the patient at the center is really what the HIE is all about. When I think about my role as the CIO in a health system, I also think about the value of the HIE is in the potential to simplify that exchange of information. So exchanging health information is not new. As providers, as individual clinicians, physicians, and certainly as health systems, we've been exchanging lots of information for many years. But we are often sending the exact same information to multiple groups, sometimes even in a different format, because the receiving group needs to define how the data get exchanged. And it's things like national health registries, the American Heart Association as an example, right? We share lots of the data about our patients with cardiac illness so that we can better improve their care. We share lots of information locally with the state agencies, the Department of Social Services, the Department of Public Health, with our hospital association, so that we can all work together to try to improve care. But again, when I think about the same pieces of information needing to be sent multiple different times, the ability instead to aggregate that data through the health information exchange, simplify and streamline all of that, takes away redundant effort on the part of health systems and providers, reduces the overall cost of that same data exchange. So that's, I think, some of what may get missed when we talk about health information exchange, but real value.
Yeah, and those are wonderful examples of value that are on top of, I think, the value that the individual patient and their family can receive.
Right.
If you were to imagine, an impact that would happen in the state of Connecticut for our population with HIE, which kinds of impacts would you really imagine would be, most beneficial?
Yeah, I hope there are those individual cases. I also remember, I have a colleague who shared with me, she has a couple of chronic illnesses, that she deals with and manages. And she made a comment to me that, she has to have a different patient portal, essentially for each organ system, right? Because the cardiologist that she sees uses one electronic medical record, and it's got a patient portal, and it's great. She can access all of her information, but it's only the information related to that segment of her care. And her, diabetes specialist uses a different system. And so she has it. And so, I think for a patient to have that single access to all of their information, we truly empower individuals in their own care. I think the pandemic probably is the next most, I think, real and relevant example. I think we all very much learned quickly the importance and the value of a real-time understanding of what was going on with the infection rate, with vaccination rates. How did those two things relate to each other? Were there areas in our communities by zip code where we saw lower uptake of vaccine, allowed us to go out very quickly, mobilize outreach and pop-up events to meet people where they were. And so all of that, again, we can all do that as individual health systems or individual medical practices, but it's far more powerful when we can look across all of our communities to ensure we're targeting our efforts in the most meaningful way.
Yeah, I think that you brought up the pandemic creating an opportunity for health systems that had traditionally been somewhat collaborating and somewhat competing to suddenly say this is in our best interest to collaborate.
Exactly.
And a functioning HIE, would permit us to do much more effective, not just information exchange, but also analytics. And
Right.
And that's a value add that I think will be a great benefit in Connecticut as well.
Right.
Can you talk a little bit about where you've been a leader in helping to not just set up a health information exchange, but to really have your organization be front and center in participation and actually, kind of helping develop the use cases and helping to, show by example why it's important. Can you talk a little bit about where Yale is right now in its engagement with our health information exchange and what you're doing with onboarding and planning at the moment?
Sure. So we started with all of our hospitals, so the 5 hospitals of Yale New Haven Health System, and began sharing what's called ADT, or admission, discharge, and transfer information, and working right now to finalize the exchange of clinical information as well from our electronic medical record. So all of the hospitals actively participating. We have the medical group that is part of Yale New Haven Health System is our Northeast Medical Group physicians. Those data are also being shared with Connie as we speak. And then we have the privilege in our health system of supporting about 350 private community physicians and 2 large federally qualified health centers who contract with us for electronic medical record services and the platform itself. And so as each of those entities has consented, because they're private organizations, they needed to sort of decide their own timeline. But as each of them has consented, we've begun to share their information as well. So we're, actively working through that. The team at Connie, I'd be remiss not to talk about, the powerful, I think, potential that we have in the team that we've built, leading the entity, the HIE entity, which is Connie. We've got a strong technology partner who have and continue to operate statewide and regional health information exchanges in other states. And so they've been phenomenal resource to work with and coordinate all of there's actually a lot of complex testing that needs to go on. That data exchange sounds simple, but it never actually is. And so ensuring we're sharing the data that we should, while continuing to protect the privacy and security of the data that we shouldn't share. Thankfully, I have a very talented team here internally in the Yale New Haven Health System, and we've, as I said, got a talented team at Connie to coordinate all that work.
Yeah, we could probably have a whole nother podcast on just standards and data standards and how information exchange occurs, and maybe it's worthwhile bringing on several guests at the same time and having that conversation in the future.
We might put people to sleep though, Tom. We'd have to be a little.
We'd have to use stories, I'm sure.
Exactly.
But can you talk a little bit about your role as a Connie board member and how you view that differently maybe than your role as a CIO?
Yeah, as a board member, I look at the role really around ensuring we've got sustainable governance and processes around the operation of the HIE as we go forward. I had the privilege of being on the search committee that interviewed, and ultimately selected Jen Searles, who's currently leading the Connie team. She's been a phenomenal resource. We're a new board. We were a very small board. We've started to add a few more positions, which is great. But it is a very multidisciplinary group. On that board with me are physicians, again, public health sector members, business people, our large insurers have a seat on the board. And so there are, I think, a really good, diverse group of people with diverse perspectives that are sort of steering the ship as a whole. So that role is one I take pride in, but there's a lot of weight there as well in ensuring the overall oversight.
Wonderful, and we're so pleased that you've stepped up to serve in that capacity. As I've experienced in the past, that is it's a challenge, and it's a weighty thing to do, and we're very glad that you're doing it.
Thank you.
We're now going to take a moment to have our sponsor support. We want to take this opportunity to thank Connie, Connecticut's official health information exchange. Connie was established in 2019 to oversee and provide services to support the exchange of health data in the state of Connecticut. Connie is an independent and not-for-profit organization. To learn more about Connie, please visit conniect.org or go to the show notes from today's episode. So getting back into our conversation, can you tell me what kind of challenges that Yale has experienced and your colleagues in other health systems have experienced in trying to implement your connection to or the actual health information exchange?
Yeah, I think one of the bigger pieces, Tom, was ensuring we had really good awareness and understanding amongst our clinicians about what Connie is, why it's important to participate, what data would be exchanged. We put a lot of value on the physician-patient relationship, and the last thing we wanted was for a patient perhaps to mention they had accessed their data through Connie and have our physicians caught off guard. So we did spend a good amount of time in open forums with members of our credentialed medical staffs, taking bits of time at other scheduled forums with clinicians to make sure that we covered that ground early. Then there's the very technical work. I mentioned the health information exchange is actually, I think, a double-edged sword, right? There's all the value in the exchange of the data, but there's very real need, as I said, to respect the privacy and security of the data. And so that balance takes a lot of time, energy, and effort. So the Office of our Information Security Officer participated early in doing that core vetting of the design of the security around the technology infrastructure that supports Connie. Participated in that security design review, documented all of the findings, worked with the technical support team to address what were some minor things, but overall, thankfully, found the technology to be very secure. Our integrations team, that's the next group that really stepped up to bat to ensure we could make the exchange of information and map the data appropriately. Part of our complexity, I mentioned we have the 350 private physicians whose data sit in our data warehouse and electronic medical record. We have our health system physician practice, and then our Yale Medicine faculty physician practice. And so within our system, all of those data are commingled around a patient for the benefit of the patient. But as we started to think about exchange with Connie, as each organization was getting to their level of readiness and awareness, again, sorting out what data could be shared, what data needed to be paused, any of the sensitive health data, behavioral health and substance abuse treatment data. So there's a lot of complexity under the hood in a large complex organization. And so we did a whole lot of testing to ensure we were sending what we should, not sending what we shouldn't. And, again, always in communication with all of our internal stakeholders around that progress. So we're in a good place today, thankfully, after all that work.
Well, and it sounds like you did several really important things. One, you kept the patient as the North Star. I think that's been a key, guiding principle of the health information exchange approach in Connecticut. So making sure that their data is respected and cared for is really critical. The other is to really engage your medical staff and your clinicians upfront and routinely, I think, in why, how it will be beneficial. And it'll be really interesting to see as the data really starts to flow in a much more substantive way, how they use it most effectively.
Right.
Can you talk a little bit about, as you know, the upcoming, well, in Connecticut, we call them use cases, but in real life, really, it's how the health information will be utilized and what type of data will be exchanged. Can you talk a little bit about the ones that you're most excited about and the ones that you're, going to sort of provide immediate value to both the patient and the providers? And it's really exciting that we're really on the edge of this for me.
Yeah, agreed. Image exchange is one that I am excited about. It's one, again, we've been exchanging images for many years, but it required, special software we have to purchase and maintain. And then people that we wanted to exchange those images with also had to have software. They had different software. You had to make those two pieces of software talk to each other. And so again, what should have been very simple was often complex. So again, for me, doing it through the HIE, through Connie, gives us that one simple way. We will exchange, send our imaging reports and the actual images into Connie, and as others do as well. And the bottom line again for patients is you avoid that potentially duplicate study because the doctor you're seeing today didn't realize the doctor you saw a month ago, conducted the same test. So again, I think there's huge just convenience, lower cost, and just that lack of duplicative care. So that one I'm very excited about. Encounter alerts. So I mentioned earlier the exchange of ADT or admissions, discharges, and transfers. As we seek to help patients navigate what is a very complex health ecosystem and ensure the right, continuity of care, that follow-ups happen and don't get sort of lost in the shuffle. Understanding where care is happening. And so, if you are a patient of one of our primary care providers and you're traveling in another part of the state and you landed in the emergency department today, seeing that encounter alert so that we could follow up with you even before you might think to call your doctor, and you might not think to because, you got cared for in the ED. And so the encounter alerts, I think, will also be very valuable. There is a telehealth use case that, again, I think will help with adoption of telehealth by a much broader, range of providers in all settings. We tend to talk a lot and think about hospitals and doctors' offices, but we have all of the behavioral health providers, the community-based organizations, who very often are not part of what we consider traditional health information exchange, but that through Connie, we do have an opportunity to share a much broader base of understanding around what patients might be experiencing gaps in care. So I think that's pretty exciting as well.
Yeah, and I've kind of had the opportunity to talk with folks about image exchange recently, and they describe what's occurring now as sort of sneaker net. You carry around a disc and as the patient, you're the primary mover of the information, and this will just really tremendously change it. We had
Exactly.
a webinar on it real recently, so I agree. It'll be a very exciting opportunity there. Um, what do you feel like the risks are with, in your role as a CIO and a role in the board? What do you think the risks are to our current HIE, and what can we do to sort of overcome some of those?
Yeah, I think one of the bigger risks is, a network, which is really what the HIE is only as good as the participants in it, right? So I think we are fortunate in the state of Connecticut that we have legislation, right, that ensures that hospitals will participate, that doctors' offices and labs will participate. All of the other provider types that I mentioned who may not exactly be mandated, but who could really bring a wealth of depth and breadth to the information in the HIE. I think one of our risks is that we don't fully capitalize on what Connie has to offer if we don't get full participation. And then even amongst those, the hospitals and the doctors' offices, if folks don't look at the data. So as a CIO, I always say that I can put in the very best system and have it create the most perfect alert or graph or piece of data and information. But if people don't look at it and use it, we will have again made an investment that didn't pay off. And so I think people need to give it a try and start to tap into the data, look at it, incorporate it into your care. I think will be how we start to see the value.
Yeah, those are great examples. It's sort of like the horse and water, challenge, right? You can lead a horse, but you can't make him drink.
Exactly.
But I do believe that with really kind of, I would call them sticky use cases, the ability to do image exchange, the ability to do maybe e-consults or e-referrals,
Exactly.
that we will have, the path that's the easiest to accomplish what the clinicians need to do. And then I also think that you mentioned, community-based organizations being able to refer someone to a food pantry or
Right.
actually handle some of the things that are 90% of their real needs. It's 10% healthcare and 90% life care.
Exactly.
Being able to assist in those things is going to be tremendously helpful, I think.
Right.
um, so tell me, give us as we kind of wrap up today, give us your bit of wisdom that you'd like to share with others that are either sitting on the sideline or just recently joining. What are your best points of wisdom for that?
Yeah, I think we've had a bit of a tortuous path here in Connecticut in implementing a health information exchange. Many attempts over many years. I think there is still a fair amount of skepticism or even disbelief that we have a functioning health information exchange. So I guess my parting words are that we do, in fact, have a functional health information exchange. That its success is dependent upon all of us as a care provider community to both contribute and use the data. And I'll put my hat on for a moment as a board member and say, if you have ideas about how we can leverage those use cases that you mentioned earlier, please, bring them forward. And we have many talented people reviewing those ideas and making recommendations to the board about which use cases we should bring forward. So Connie is it's a resource for all of us. And so I encourage everyone to try to make it as useful as we can.
Those are excellent words of wisdom, and I would like to say that I would hope that when we come back and have a conversation again in maybe a year, that it will be we'll really be at the place where we can say Connecticut's a leader, and that we're not just adopting what others have done, but we've actually transformed the way we're doing healthcare. So thank you so much for spending time today with me, Lisa. And you've got heavy lift ahead, but I'm very confident that you and the other board members and the leadership of Connie will actually really move us forward in very positive directions.
Thank you, Tom.
As always, wishing you the best of health. Your host, Tom Agresta.